Have you ever wondered how a seemingly innocent case of chickenpox could come back to haunt you? With this video, I will attempt to explain the mystery surrounding shingles, a condition people need to learn more about. Welcome back to my channel. With this video, you will understand what shingles is and how it happens. This video will equip you with information on identifying it, as well as exploring how to protect yourself and your loved ones. But before we start, do not forget to hit the subscribe button and the notification bell so you do not miss out on future videos and health tips. So let's dive right in. Shingles, also called herpes zoster, is a viral infection that causes the painful rash. Shingles is caused by the varicella zoster virus, which also causes chickenpox and never leaves your body once you've had chickenpox. Imagine it's like a sneaky house guest or invader that refuses to leave your body but instead hides on one of your nerves. So how does it happen? Well, once you've had chickenpox, the virus goes dormant, quiet, chilling in your nerve cells, and then sometimes it may reactivate, leading to shingles. The term shingles comes from the Latin word cingulum, which means belt or girdle, and that is because the rash has a characteristic band-like or belt-like pattern, usually on one side of the body. So who does it affect? Shingles can affect people of all ages, although it is more common or prevalent in those over 50. Shingles is also more common in those that have conditions that can cause a weakened immune system. Up to 20% of people will develop shingles in their lifetime, but it is seen in those that have had chickenpox in the past. Occasionally, you may have some people that may develop shingles and not realize that they have had chickenpox in the past. But why does it suddenly wake up and cause trouble? The culprit is a weakened immune system, which could likely be due to aging, stress, and illness. Cancer and chronic conditions, chemotherapy, immunosuppressive medication taken by those with autoimmune conditions or those that had an organ transplant, as well as infections like HIV, can weaken your immune system. So let's imagine it's like your body security guard taking a break, allowing this virus to throw a party on your skin. Now, let's talk about how you identify shingles. The first sign is usually a unique sensation or pain affecting one side of your body or face. This unique sensation is typically described as an itching, burning, or tingling sensation in an area of skin on one side of the body. So feeling unwell or even a headache. Within a few days, this will be followed by a rash that can turn into fluid-filled blisters limited to one side of the body in a band-like or belt-like pattern. This shingles rash most commonly affects the trunk, which is the chest, the abdomen, and the back, although it can affect any body part. In some cases, this rash could develop around the eye, and if it is left untreated, it can cause really bad eye complications. That can be permanent. Note that the pain associated with shingles can be severe enough to interfere with your daily activities and even sleep, and it tends to be worse in older adults when compared to the younger counterparts. Within 3 to 4 days, the shingles blisters will burst, leading to open sores and ulcers. In individuals with a healthy immune system, these sores will cross over, and by day 7 to day 10, they will no longer be infectious. Generally, within 3 to 4 weeks, this rash will disappear, although scarring and some skin discoloration may persist long after the condition has resolved. Are shingles contagious? The answer is no. You cannot get shingles from someone else. However, if you have never had chickenpox or the chickenpox vaccine, you can get chickenpox by coming into contact with someone that has shingles. This can happen after direct skin-to-skin contact with the shingles rash, or in rare instances by breathing in the varicella zoster virus through the air. For this reason, if you have never had chickenpox or the chickenpox vaccine, please avoid being around anyone with the shingles rash. Let your doctor know if you feel that you have been exposed to shingles. Similarly, if you have shingles, please avoid being around those that have never had chickenpox or the chickenpox vaccine so you do not infect them. In most cases, shingles will run its course without any lasting health problems. But sometimes you could have a complication called post-herpetic neuralgia, which is when you have long-lasting pain lasting longer than 3 months from the onset of the shingles rash. Other complications could include a skin infection, eye complications, and it could also involve your ear, as seen in conditions like herpes zoster oticus or Ramsay Hunt syndrome. Although shingles can be uncomfortable and painful, there is good news. If it is caught early, antiviral medication can be started, which can stop the virus from multiplying, cause the rash to get better more quickly, and also reduce the duration and intensity of the symptoms. The pain related to this condition can also be severe, requiring pain medication. Your doctor may prescribe medication like NSAIDs like ibuprofen, naproxen, or even Tylenol to help with the symptoms if it's mild. If the pain is severe and not responding to this medication, your doctor may opt for stronger options. So do not ignore or try to bear the pain. There are options out there that can help with your symptoms. Let your doctor know as soon as possible. I know we just spoke about how to manage this condition if you have it, but did you know that prevention is the better option? You can reduce your chances of getting shingles by taking the shingles vaccine. This vaccine is recommended for those aged 50 and older, but in some cases it can be given to those that are younger if they have a weakened immune system. Suppose you do develop shingles after getting the vaccine. It may help reduce the severity of the infection, and you're also less likely to develop post-herpetic neuralgia, the complication I mentioned earlier that can cause pain lasting 3 months or longer after the onset of the skin rash. In conclusion, shingles can happen when the chickenpox virus wakes up from its slumber due to a weakened immune system. The best way to protect yourself is through vaccination, and if you do get shingles, early treatment can mean a world of difference when it comes to your comfort and recovery. Now that you are in the know about shingles, take action. Share this video with family and friends so that they can be well equipped to handle this sneaky virus. Stay informed, stay healthy, and do not let the shingles virus catch you off guard. Thanks for watching. If you found this video helpful, hit the like button, subscribe to this channel, and hit the notification bell to stay updated about our future videos. Take care of yourselves, and I will see you in the next one.